Now I request Dr. Sujoy Kaur, Director Medical Services Apollo Gleneagles, to come and share his vision. We are running short of time. I will just request you to finish in 10 minutes.
Namaste. Good morning. I was not supposed to be here. Dr. Rupali was supposed to be here, but she had to take a flight in the morning to be present in a meeting in Delhi. Distinguished dignitaries in the dais, we have heard them all from things that have ranging from infection control to the health economics and how disruptions are happening in many parts of the world, particularly in Eastern India, about how we are looking at the payer-provider balance and what we are actually doing it. Wonderful to know the kind of things that are happening back at Guwahati, sir. I bring here, I didn't have a presentation prepared. I bring here a talk which I would like to do, which I sometimes teach at my students at IIT Kharagpur, about 4 distinct paradigm shifts that you need in healthcare at this point of time. And these paradigm shifts are not looking at the cost element as of now, but probably we will build it as it happens. But the 4 distinct things which can probably change the way we look at the relationship between patient and the doctor, between the accessibility, the knowledge perceptions, the change, the innovations that come through, and what the doctors imbibe over a period of time. The first is change the way the medical education is given. The 5 plus 3 plus X is not equal to 40. You have 5 years of MBBS, 3 years of MD or MS or anything, and X years of your post whatever super specialization you do. And then you have a license to practice that branch for next 40 years. What is that we need to bring in as an innovation where there are constant changes? The way the medicine was practiced in 1980s is no more the same way the medicine is practiced this day. There are changes, there are shifts, and we have to bring along them and how our doctors, not in the tertiary care hospital or secondary care hospital, but in the community, are taking to those changes, taking the challenges of technology, taking the challenges of information and changing themselves over a period of time. That is one area that we have to look at because, as I said, 5 plus 3 plus X is not equal to 40, and it doesn't apply anymore. The second thing which I always look at, I also I provide my consultation with Joint Commission International, including sometimes when they have problems with some hospitals related to adverse events. The primary thing that we find in the care process which are problematic are communications. The doctors do not communicate, do not spend times with their patients. They do not say what is going on. They're busy. But in modern day, when people come, even before they arrive to your outpatient clinic, they are half knowledgeable because of the plethora of information that are available on net. You have to provide them with the right sense of the right kind of information to move ahead in that front. So my second point is to get communication at the core of care processes. And we can talk about it and a lot more, particularly in the context of patient safety and improvement. The third is we have heard since morning technologies, information, and all of that. Again, there's an enormous amount of explosion of this information and technology. And every day you come up with new technology. I remember in I'm an alumnus of Massachusetts Institute of Technology. In that center, 50% of work that is happening on this day is related to healthcare. And everybody from Google to IBM to Biogen to Amgen to Novartis to Pfizer to anybody you name in healthcare is present there and bringing in innovation. Are all of these innovation good? Are all of these innovation perfect? Are the kind of things that we are bombarded with are the ones that would remain as a test of time for the coming next 30, 40 years as a standard of care? That is something that we have to think, pick up, and move ahead in the front. Not all information, not all technology are good. I was thinking of giving a demo, something from my iPhone, but because the time is short, I will not be able to. We talk of eICU. Today, I have MICU in my pocket. There is a technology called Airstrip, which can, at this point of time, provide me with information of what is happening to my patient in XYZ bed number, and his ECG, his bloods, his all the records, his X-rays, his imagings are all available to me in a couple of seconds in my iPhone, and I can probably guide the treatment in that. But how are we taking that is something that we have to look at. The final thing that I wanted to talk about is bringing in about predictive analytics in healthcare. Conventionally, the way we have done medical research of non-inferiority, research of saying hypothesis testing has to go. Because we are now piled up with a lot of data across the world, across different regions, on good, valid data coming from the healthcare across, whether it is from the community, whether it is from tertiary care hospitals, because we have been looking seriously into our medical records. Some of them are made into IT systems, some of them are electronic, but whatever it is, we are sitting on a huge database at this point. We can use this data now from an Indian context, use predictive analytics, and do good for the community. Yesterday, we published a study of about 10,000 patients that we did in slum area. This is done by Apollo Gleneagles Hospital and Kolkata Municipal Corporation. Staggering data. 43% of people in slum have hypertension, out of which 23 of them are already having hypertension, and 19% do not know that they have hypertension. And most of these people do not have uncontrolled hypertension because of the fact that they are on a 3-drug or a 4-drug regimen, but they take, on a compliance basis, only 1 drug. Now, this is where predictive analytics can come in, help, look into the big data, and say how we are going to take in front. So these are the 4 definite areas that we have been working on. I'm personally, a couple of my research is currently on with both my alma mater and with IIT Kharagpur, and we're trying to bring in more and more of this into the health system. Thank you very much. Hope you have a nice conference. Thanks for Let's to call us here and do that. Thank you very much.
Thanks a lot, Dr. Sujoy Kaur, Director Medical Services, Apollo Gleneagles.